Hi everyone. So today we are going to do ABG interpretation, very easy and very simple way. So we are going to find out how we are going to find out if this is alkalosis and if this is acidosis. We need to know some basics about the ABGs, and in this video I will show you how to interpret that and find out if this is respiratory alkalosis or is it the other way around. Then we are going to start with the the first thing first. Let's start with the case. A 50-year-old woman underwent intestinal bypass for morbid obesity. She has 10 to 15 watery stool motion per day. She was treated by a tincture of opium. Next day, she was found somnolent and hypotensive. The plasma values were, so we are going to get the plasma values, and the laboratory values shows pH, PaCO2, HCO3, sodium, potassium chloride, and with this, we are going to do the diagnosis. By the end of the lecture, we will see what the diagnosis is. You can post the diagnosis in the comments. So first thing first, what we need to know in the systemic ABG analysis, history taking and physical examination. We are going to look at the patient, ask some questions, how in this question, we get to know that what the patient was experiencing in the first, and then how she was treated, and later on, how she presented again in the emergency department. So assess the accuracy of the data. If the data is correct or not. Identifying the primary disturbances, checking by the arterial pH. So pH can lead you to find out if this is acidosis or this is alkalosis. Then HCO3, PCO2 analysis, finding out the primary disturbances, primary, and then finding out if there is any compensation going on, the compensatory responses, if this is already compensated or it's not compensated. Then calculated anion gap, then assess the delta gap slash ratio. That's just an option. If you want to find out, then it's totally up to you. Urine anion gap, and then formulated acid base diagnosis. So some important clues in the history, what you can find out. So first thing first, pulmonary embolism that can lead to respiratory alkalosis. Then going to cirrhosis that can lead to respiratory alkalosis as well. Then dehydration and the shock hyperkalemia as the situation above. We had metabolic acidosis. Then vomiting hypokalemia can lead to metabolic alkalosis. Then sweat, diarrhea, salicylates, or the alcohol toxication, metabolic acidosis, renal failure, hyperglycemia, and can lead towards the further metabolic acidosis. Now, with all of these things, let's suppose if in the scenario it's given that this person is having cirrhosis, this can give you an idea of this person might be having respiratory alkalosis. So in the MCCQ one, this is one of the very important thing that you find the clues in the question that can actually help you to save a lot of time. So you might not read all of the scenario. Let's suppose if you read all of the scenario and you cannot come up with any solution, they gave you the patient was having cirrhosis and multiple other symptoms as well. This cirrhosis might lead you toward the respiratory alkalosis and what the answer is actually. So you don't have to look into other further information that might be misleading and misguiding you towards the other option. So always go with the basics one, then find out what the question is asking. So with the further finding out and reading the question, you can get to know that this question was all about cirrhosis leading to respiratory alkalosis. So always go with the basics one. And this table you have to remember. Now, again, the first thing for systemic ABG analysis, all of those things, it will just keep on reminding you what you need to do. So in the next part was finding out if the accuracy of the data, if this is validity or not, how you are going to do that. This equation is very important. You have to remember it. What is that? How you're going to find out the proton value by the Henderson-Hasselbalch equation. PCO2 divided by HCO3 multiplied by 24 is equals to pH minus 7.8 multiplied by 100. So acidosis and alkalosis can lead you toward if you put on this situation. Then how you're going to calculate it, then putting the values of the PCO2, HCO3, what is given, and then multiplying it to 24. So you're going to get that proton value. Then again, what is the next thing we are going to find? Identifying the primary disturbances. If this is acidosis or this is alkalosis, what are we going to do is basically identify the primary disturbances. Normal acid base values. This is very important if you remember the normal values. Although they give the normal values in the exam, you can find it out, but just to save your time, it's best if you can remember the normal values of the few things which is very, very common by your heart. So you don't have to keep on looking it again and again and wasting your time. Let's suppose if you know the normal value of pH, you don't have to find out and go to the check the all the normal values and then finding out if this is acidosis and alkalosis. So normal pH is 7.35 to 7.45 with the by partial carbon dioxide 36 to 44, and then HCO3 is 22 to 26. Let's suppose if they have given you a specific value, now you don't know. Okay, so in those times you need to know the optimal value. Optimal value is very, very important, more than the range value. So 7.40 PCO2 is 40 and HCO3 is 24. So this is the optimal value. Now identifying the primary disturbances. Now by getting the arterial pH, we are going to look for two things, the pH and then partial carbon dioxide and HCO3. So pH is less than 7.35 or more than 7.45 can leads you toward acidosis or alkalosis. The body does not fully compensate for the primary acid-base disturbances. So looking for the second one, look for the partial carbon dioxide and HCO3. If this is very, very important. If PCO2 is the initial chemical change, then process is respiratory. If HCO3 is the initial chemical change, then the process is metabolic, weak acidosis, and then weak alkali. Classification of acid-base disturbances. What is the most important one? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. Now, if we have to look up for the shortcut of it, if there is a metabolic acidosis, we are going to look for pH and then looking for the HCO3. So this is the first disorder. If they both are in the same range, like decreasing, pH is also decreasing and partial carbon dioxide, HCO3 is decreasing, then it is a metabolic acidosis. Don't look for the compensation for now. We'll discuss this later on. Now, what happened is in the scenario, pH is decreasing as well as HCO3 is decreasing, but the partial carbon dioxide is normal. So this is a metabolic acidosis without any compensation. Though, so the primary disorder would be primary metabolic acidosis. Same goes for the alternative one, metabolic alkalosis. pH value is higher and partial carbon dioxide, HCO3 is high. So it can lead towards the metabolic alkalosis. But when we are looking for respiratory acidosis, it's always in the opposite direction. The partial carbon dioxide would be increasing and pH level would be decreasing. As goes for the respiratory alkalosis, the pH level would be increasing and partial carbon dioxide would be decreasing. So in the respiration, it's opposite, but in the metabolic, it's the same. You can remember one of it and can use as an alternative for the other one. Now, let's talk about compensation. What happens in the compensation is if we are going to discuss with the metabolic acidosis. If pH is decreasing as well as HCO3 is decreasing, but at the same time, you notice that carbon dioxide is also decreasing to maintain the compensation. As we know, if the carbon dioxide is decreasing, it can lead towards the alkalosis, as you cite here in this option, right? So what happened is it was already in acidosis. When carbon dioxide is decreasing, it is leading towards the alkalosis, means maintaining the compensation and making the acidic environment to alkalotic environment. Same goes for the metabolic alkalosis. What is it happening is pH level is increasing as well as HCO3 is increasing. But in this point, PCO2 is increasing because it is causing the acidic environment to compensate the alkalosis. So what happened is, which is called compensatory metabolic alkalosis. Okay, so you need to look. Let's like first thing first, if it's going in the same direction as of HCO3, as of pH value, then it is going with the metabolic acidosis. Let's suppose if this is not given, only pH, PCO2 and HCO3, three things are given. Now, how are you going to find out if this is a compensation or if this is primary disorder? We are going to look for the pH values first of all. We are going to see if this is acidotic or this is alkalotic, right? So if it's decreasing, then it's acidotic. Now we are going to compare this pH with the other value of bicarbonate or with the partial carbon dioxide. If bicarbonate, let's go with the bicarbonate. If the bicarbonate is in the same direction, it means this is a metabolic acidosis because bicarbonates is decreasing, it creates the acidotic environment. Then pH level would be decreased as well. As at the same time, if the PCO2 is decreasing, and it's against the law of how PCO2 will decrease, but pH would be increasing, right? But here it's opposite. So it means it is causing the compensation. All you need to know is this much. You don't need to go if this is compensation, then if it's already compensated or not. You just need to know the basis of if this is a compensation one or it's not. Okay. So simple thing, simple. First, you need to know if this is a primary disorder. And second thing, you need to know if this is compensation or not. That's it. You don't need to go into the further of it if it is compensatory or if the compensation is done. If the compensation is done, then the pH level norm value will be in the normal range, right? So you don't have to go into very detail of it, just the basis of it, what I already elaborated. You just need to know this much. Then again, if we are going to do with the metabolic alkalosis, pH would be increasing, the bicarbonate would be increasing, but the partial carbon dioxide would be also increasing. Now the respiratory acidosis, pH level will be decreasing and the bicarbonate would be increasing. But the partial carbon dioxide would be also increasing, which can lead toward the respiratory acidosis because pH is going along with the bicarbonate but going against the partial carbon dioxide. So pH and partial carbon dioxide is against. It means this is a respiratory problem. And the bicarbonate is changing. It means the compensation is happening. And if pH level came to the normal, then it means that the compensation has been done. That's it. You don't need to know more than that. Now, acid-base balance. What happened is respiratory is opposite, but metabolic is equal. As we already discussed, the basic thing. Respiratory acidosis always go with the bicarbonate, but in the respiratory, the pH goes in the opposite direction with the partial carbon dioxide. This is very important. If you remember this much, you don't need to remember anything else. Like go with the Rome. Respiratory opposite, but metabolic is equal or in the same direction. So metabolic acidosis, pH is decreasing, partial carbon dioxide is also decreasing, but bicarbonate is also decreasing as well. So it is going to the metabolic acidosis. Now metabolic alkalosis, pH is increasing, bicarbonate is also increasing, but the PCO2 is also increasing, leading towards the metabolic alkalosis. Then coming to the respiratory acidosis, pH is decreasing, and then PCO2 is also increasing. Respiratory alkalosis, then pH is increasing, and then PCO2 is decreasing. Now, if this is something which is like mixed acidosis and mixed alkalosis, you don't need to go into very detail of this one. You can just skip it. Now, we already did the history taking and physical examination. We did the validity with the equation and then identify the primary disturbances. Now we are going to do the compensatory responses in the next lecture. See you then, guys. Have a good day.